Today we are looking at the topic of tumor markers. So to start with, asking a few questions. So where is the tumor marker alpha fetoprotein seen? Next, in case of the renal cell carcinoma, what is the tumor marker? Next, in case of the bladder cancer, what is the tumor marker? So in this video, we will see the answer to all these questions and a lot more. So firstly, looking at the hormones. So under this, the tumor marker, it includes the human chorionic gonadotrophin, and the tumor types, it includes the trophoblastic tumors as well as the non-seminomatous testicular tumors. Next we look at the calcitonin. So calcitonin, the tumor types, it includes the medullary carcinoma of the thyroid. Next, moving on to the catecholamines and also the metabolites. So this is seen in the pheochromocytomas as well as the other related tumors. Next, we move on to the oncofetal antigens. So in oncofetal antigens, these are seen in the liver cell cancer as well as the non-seminomatous germ cell tumors, and this is of the testis. Next, we look at the CEA, that is the carcinoembryonic antigen. This is seen in case of the carcinoma of the colon, the lung, the stomach, as well as the heart. So now moving ahead, we look at the enzymes. So under the enzymes, firstly we focus on the prostatic acid phosphatase. So this is seen, as the name suggests, in case of the prostate cancer. Next, looking at the neuron specific enolase. So this is seen in case of the small cell cancer, and this is of the lung and the neuroblastoma. Next we look at the LDH. So LDH, it is seen in the germ cell tumors as well as the lymphomas and the leukemias. Then we look at the thymidine kinase. So here it is seen in case of the leukemias. Then moving on, we look at the pyruvate kinase. So in case of pyruvate kinase, it is seen in case of the RCC, that is the renal cell carcinoma. And in case of the placental, alkaline phosphatase. So this is seen in case of the seminoma. And now we are looking at some specific proteins. So specific proteins. So under this, the immunoglobulins. So this is seen in case of the multiple myeloma and the gamma pathies. Then we look at the PSA, that is the prostate specific antigen, and the prostate specific membrane antigen. So this is, as the name suggests, is for the prostate cancer. Now, going back, we see the NMP22. So this is what is seen in case of the bladder cancer. Then looking at the mucins. So mucins and the other glycoproteins. So in case of the CA, this is very important, 125. This is seen in case of the ovarian cancer. Then looking at the CA 199, this is seen in case of the colon as well as the pancreatic cancer. Then moving on to the CA 153, this is seen in the breast cancer. Now we look at the cell-free DNA markers. So the cell-free DNA markers we are seeing at TP53 and the APC as well as the RAS mutants, and this is seen in case of the stool as well as the serum. So where is it seen? It is seen in case of the colon cancer. And next, looking at the similar one, that is the TP53 RAS mutants, and whereas this is present in the stool as well as the serum. So this is seen in case of the pancreatic cancer. Next variation, we see the TP53 and the RAS mutants, and this is seen in case of the sputum and the serum. So this is seen in case of the lung cancer. Lastly, looking at TP53 mutants. So this is seen in case of the bladder cancer. Now we are going to answer the questions which we asked earlier. So in case of the alpha theta protein, so the answer is it is seen in case of the liver cell cancer as well as in cases of the non-seminomatous germ cell tumor, and this is of the testis. So the next question was, in case of the renal cell cancer, what is the tumor marker involved? So here it would be the enzyme pyruvate kinase. And next question was with regard to the bladder cancer, what are the tumor markers involved? So in case of the bladder cancer, the tumor markers involved is the NMP22, as well as we saw in the last stage, that is in case of cell-free DNA markers, it also includes the TP53 and these mutants are present in the urine.
Hello everyone, this is Dr. Hub. Now let me tell you our story. Running with us, we are sure you will reach your destination with ease.